Welcome to the digital seminar series organized by the Statistics Assessment and Data Management Core, a part of the HIV Center for Clinical and Behavioral Studies at the New York State Psychiatric Institute and Columbia University.
Hello, welcome to an Implementation Science Fundamentals webinar. What is and isn't implementation science? This is the first in a mini webinar series of the Columbia University HIV Center, offering short introductory nuggets that lay out some of the basic concepts, tools, and methods comprising the growing field of implementation science. The webinar and subsequent ones are intended for researchers as well as implementers who have heard the term implementation science, which is sometimes referred to as IS, but don't know what it means or how to apply it to their work. So the purpose of the HIV Center is to advance the scientific purpose of solutions for global challenges related to HIV/AIDS. So many of the examples in this webinar will draw upon issues within the field of HIV. But the sessions are really intended to offer lessons that can be more broadly applied beyond HIV to other areas of health, healthcare, and policy. So there are two primary learning objectives for this webinar. The first is to define implementation science, which includes talking about the purpose of an IS approach, as well as an overview of the kinds of directions you can take when you're developing implementation science research projects. And the second objective is to differentiate implementation science from implementation activities. If you work in intervention-oriented settings as a researcher or a practitioner, you probably do implementation already. However, this doesn't mean you are doing implementation science. And by the end of this webinar, we hope you'll be able to understand the value added when we add this term science onto implementation. And we hope to also show how IS compares to some related work you may already be doing involving implementation, such as program evaluation and quality improvement. So a good place to begin to talk about implementation science is to think about a problem that we want to look at and talk about how implementation science can be applied to solving that problem. This is really to start to think about why we're using implementation science. So here's a case study. There's growing realization, growing evidence around the importance of introducing antiretroviral therapy as quickly as possible once a person has a positive HIV diagnosis. There's been several large-scale studies. One study called the RAPID has shown that time to viral load suppression, or VLS, is reduced and patient retention increases for those starting on antiretroviral therapy on the day they are diagnosed compared to those who start later on treatment. The mounting evidence has led to the development of guidelines to encourage practitioners to begin prescribing ART immediately in clinical settings. However, adoption or uptake of these guidelines, the implementation part, seems to be slowed. Results from a 2019 Columbia University HIV Center funded pilot study surveying HIV providers in New York City showed that many do not practice immediate ART in HIV clinics, even when knowledge of immediate ART, a rapid start, is relatively high. Only 22% of survey respondents reported initiating ART on the same day of a reactive test for over half or over of their newly diagnosed patients. And a quarter of respondents also reported that they did not initiate ART to newly diagnosed patients on the same day of a reactive HIV test at all. So here we have a kind of classic case of what's called we could call a no-do divide. Scientific evidence gives us knowledge or an evidence base about best clinical practices, but the practice or the doing is lagging behind. Estimates are that on average, there's a 17-year no-do gap between discovery and adoption of practice in real-world settings. The World Health Organization has declared that bridging this gap is one of the most important challenges for public health in this century. It also poses the greatest opportunity for strengthening health systems. So, implementation science enters in here to try to narrow this no-do divide. There are various definitions of implementation science, but one that I like, that I think is quite succinct and hits at some of the core areas of implementation science that we want to take up, is that implementation science is the scientific study of methods to promote the systematic uptake of research findings and other evidence-based practices into routine practice, and hence to improve the quality and effectiveness of health services. So let's focus in on the words methods, systematic uptake, and improvement. So those words will come up again and again as we just start to unpack implementation science in a little more detail. So we can really think of implementation science as this bridge between research to secure the evidence base of what works and developing research that can show us how to really put results or put that evidence into practice to actually change and make improvements. You can think of it as bridging research. Here's another visualization developed to understand how and where implementation science fits into the continuum of health-related science and health-related research. This is the translational science continuum. So typically, early research aims to figure out which interventions will work better than what is currently known or practiced. These are often called T1 studies on the left side of this figure. And they take place in the most controlled environments. They aren't aiming to emulate the real world as much as sort of mute the background noise as much as possible to see if under optimal conditions, a new treatment or clinical practice is actually better than what already exists. Once there's this evidence that this new thing is actually better, the study moves into T2 effectiveness studies to see how they can best be operationalized in real practice. Implementation research is situated within this later phase of research to figure out how to enable the implementation of new practices across multiple different and often very diverse types of settings. Now, while this depiction is linear, more recent thinking in implementation science suggests that these steps may not, or perhaps should not, go in a straight line, nor that T1 is or should be totally discrete from T2. More recent models attempt to bridge this no-do divide more expediently by coming up with study designs that build in translational and implementation research earlier in the research process and to use implementation findings to improve the relevance of next generation T1 studies. So another point that is made in this slide is the importance of community and community partnerships, particularly as we move into real world settings, where the involvement of those delivering and using services will optimize how we conduct research and its relevance across diverse settings. We won't talk so much today about the building of partnerships and communities around research, but further follow-up webinars will talk about this in more detail, which is an important element that cross-cuts a lot of implementation science research. So at this point, let's really try to carve out some of these core implementation science features. First, it's a science of working in applied real-world settings. It's real-world research, which means it's not trying to, these projects, implementation science-oriented research and projects aren't trying to control for the messiness of the real world. Instead, research studies acknowledge and invite real-world complexities to kind of into the research as a way of getting research into practice settings more quickly and efficiently. So going back to the work around the IART study, we want to think about the complexity of delivering care immediately in clinical settings to understand how we can best implement Rapid Start. The second point, as it says sort of on the tin, as one might say, implementation science really is meant to be a science, which means the questions are answered in a systematic way to enable results to be generalizable and as widely applied as possible. Implementation science brings in theories, concepts, and frameworks from various fields and disciplines, because to understand the adoption of new practices within complex organizations, we really need to draw from a wide variety of fields, including psychology, sociology, anthropology, economics, public health, and other fields. Similarly, as we engage with different kinds of disciplines and different disciplinary frameworks and approaches, we're also really bringing in different research methods, particularly the integration of qualitative and quantitative methods. Quantitative methods typically identify and track what can be measured or counted, while qualitative methods are trying to capture non-numerical data, particularly how and why things happen. It's particularly helpful when studying processes of adoption, which is really one important area of implementation science that we'll get into in a minute. Integrating qualitative and quantitative methods can give the fullest picture of what's occurring when implementing new practices, strategies, and interventions. And finally, external validity prioritizes generalizability of trial results to other relevant populations and situations. While efficacy studies value internal over external validity, this balance shifts in IS studies. Although the effectiveness trial must have sufficient internal validity to be carried out successfully, explicit design decisions are made to conduct studies across multiple diverse settings to optimize the potential for generalizability beyond the trial itself. So now we're going to get into some of the areas of implementation science. When you're developing your research projects, you're really wanting to focus on particular ways of applying implementation science. There are three areas we can kind of divide up this field, this area of work into three areas. And this is how you might think about pursuing your projects. So if we're going to think about the study of applying implementation strategies to improve adoption of interventions, we're going to talk about the study of the process of implementing strategies to improve adoption of interventions. So implementation strategies, implementation processes. And then finally, we're going to talk about developing measures to be able to capture in specific quantifiable terms the reach and use of new interventions. And that has to do with developing implementation outcome measures. Each of these areas draw, as we've said, from interdisciplinary theories and methods. And now we'll go over each of these in a little more depth. So first, implementation strategies. So these are activities to put or enhance how a program, strategy, or intervention is put into place. So this slide is a little bit of a thought experiment to try to best understand what we mean by implementation strategies. So a mental exercise might be to think about going bowling. And I don't know that much about bowling, but to me, this example sort of resonates. Okay, so we go bowling, and the goal when we're bowling is to knock down a lot of pins, right? And we have to choose a bowling ball to be able to, we hope, knock down as many pins as possible. So the ball that we choose, that will be our implementation strategy. And we're trying to be strategic, right? We want to figure out that we want to get the right weight of the ball. We want to think about how fast we're going to, or the speed with which we're going to throw this ball. We want to really get the ball and our method of using the ball just right so that we can hit the pins, right? And the pins are our target efforts. In the health research world, the pins are the adoption of new practices. Knocking down the pins is how we measure making a clinical difference. So it's not the pins that we're focused on, but we're focused on the ball that we need to achieve knocking down those pins. So we want to be deliberate in choosing the pin to match our needs, right? We want to choose the intervention strategy that will help us optimize getting that intervention into practice that will make a difference. Our strategies may be numerous, right? We might have to think about different kinds of strategies being brought together. And we really want it to fit within the context so that we can make change. Now, when you're thinking about the strategies that you might want to use, you don't have to just sort of pick them out from the sky. There are existing frameworks and existing approaches that have delineated implementation strategies that are known to work. One place you might want to turn is the ERIC project, the Expert Recommendations for Implementing Change, which was a deliberative process to identify 73 discrete implementation strategies, which are grouped into 6 categories, including planning strategies to help stakeholders gather data, select strategies, build buy-in, initiate leadership, develop relationships that are necessary for successful implementation. There are education strategies to inform a range of stakeholders about the innovation or implementation effort. There are financial strategies to incentivize the use of programs and practices and provide resources for training and ongoing support. Strategies to restructure organizations, perhaps alter staffing, professional roles, workflows, data systems to try to support enabling use of the interventions. Quality management strategies to put data systems and support networks into place. And then those kinds of strategies that will attend to the policy context to encourage the promotion of programs and practices through, for example, accreditation bodies, licensing boards, legal systems. So this could be a good sort of menu of strategies that you might want to turn to initially to figure out what strategies might work best for the kind of intervention you're trying to support or enhance putting into place. That's sort of one dimension of in implementation science. The next has to do with implementation process. So these are projects within implementation science that really wants to use a systematic investigation of the factors and the processes, the how and the why, or sometimes the why not, a program, strategy, or intervention is or could be put into practice. These are studies that will look at the processes and factors of implementing those implementation strategies that we just talked about to enhance the uptake of evidence-based practices. So they could be specific selected intervention strategies, or these kinds of projects can look at the adoption of evidence-based practices under more sort of naturalistic conditions. So what happens even when implementation strategies aren't that well defined and put into place? So what's happening on its own, sort of in these various settings? These kinds of process studies are able to look at complex bundled intervention strategies and the adoption practices, and they can look at different factors at different levels, from individual, interpersonal, up to structural level factors that may influence implementation. Now again, if a process orientation is appropriate for the kind of work you're doing, how are we getting interventions into place? You don't have to just develop that on your own. There are existing theories, models, and frameworks that can be drawn upon that are pre-existing that you can select and apply within your project. So here is a slide showing several of these approaches, of these frameworks. The Consolidated Framework for Implementation Research, the CFIR, the Diffusion of Innovations, and the Practical, Robust Implementation and Sustainability Model, PRISM. And they each are organized in different ways and will help you gather slightly different kinds of data to describe the process of implementation. Going one step further in how you might apply, for example, the CFIR, the Consolidated Framework for Implementation Research, to a implementation science-oriented study. we're going back here to the study we talked about earlier, the immediate ART study. In addition to a survey part of that research, there was also a component of that research study that used semi-structured qualitative interviews with providers to try to understand barriers and facilitators to adopting immediate ART. So we can take the CFIR domains. There are 5 domains, 5 general domains, which actually you can see laid out in this figure from the previous slide. Intervention domain that describes the characteristics of the intervention. Outer domain, inner domain, process domain. Those are 4 of them, and the individuals involved is the 5th domain. So we can take 3 of these domains, for example, and apply them to the interview data to try to understand how elements or constructs of the intervention, elements or constructs of within the inner setting and within the outer setting may actually influence the uptake or the lack of uptake of same-day ART. Now, with future webinars, we'll go into more depth in how to apply CFIR, so we're not drilling into all of the constructs associated with each domain. But for example, with intervention, the kinds of tests that are performed and whether they can be done on the same day as a patient presents in a clinic, whether a rapid test is enough to start prescribing ART or whether providers are more comfortable using a rapid and a confirmatory test, will very much determine the speed with which ART can be prescribed. So the CFIR can be a framing and organizing framework to try to help you understand the different dimensions that are important within the process of implementation. Moving on to implementation outcomes and measures, these are really measures that can help you determine the extent to which implementation-oriented indicators or outcomes are achieved to improve the sustainable adoption and implementation of your evidence-based interventions. So implementation outcomes are not solely the intervention outcome. It's the extent the intervention has been implemented. So an intervention outcome might be, going back to the IART, how fast patients achieve viral load suppression when they start on ART on the day of diagnosis, right? So that is a health outcome we might be interested in once the intervention is being used. But our implementation outcome will look at, for example, the percentage of patients who are offered a particular treatment like IART out of those eligible. So how widespread are we implementing this intervention? That's really the kind of measure that helps us understand how implementation is occurring. Again, feel comforted that you can turn to the literature and you can turn to existing work and frameworks to help you structure your projects if you're interested in developing implementation measures. REAIM is a commonly used implementation science framework to define the measures that you might want to use to be able to study implementation or to take stock of the degree of implementation. And there are 5 areas or domains within REAIM. REACH will help you develop measures that can look at the proportion of uptake of interventions over eligible participants. So that's similar to the measure that I described a moment ago around the number of individuals who would be receiving IART within a total universe of eligible participants. Effectiveness is another type of measure to develop around the positive and negative consequences of the program. Adoption looks at the proportion and representativeness of settings who are taking up the intervention or adopt the intervention. So this is really a measure that can help you look at diverse and different kinds of settings within a larger geographic area when we want to get at the real world nature of implementation. Implementation measures can really measure out how the program is delivered and whether it's delivered as intended within the program and to which patients. And then maintenance deals with measures that look at the long-term sustainability of the uptake of those programs. So do certain interventions become institutionalized, particularly after perhaps funding cycles end or the initial trialing of an intervention? So those are three directions to take within implementation science. The next few, sort of the last few slides, are just trying to carve out some distinctions between implementation science and some of the other areas that you may be working in if you're working in implementation. So first, quality improvement is not implementation science. And you may be doing quality improvement, which can be really important for your organization. But when you're doing that, you're not really doing implementation science. So quality improvement is seeking rapid tests of change to be able to figure out what works in small scale to make broader changes within organizations. It is a measurable approach, and it may try a lot of interesting strategies that lead to better implementation of particular evidence-based practices, but the conditions of implementation aren't really systematically studied. All those factors and processes that we talked about within the inner setting and the larger context or the outer setting isn't really factored in around whether those various strategies are working or not. So we're not really in the realm of implementation science when we're doing quality improvement. Or we're in the realm, we're touching it, but we're really not doing implementation science. If we're doing dissemination, trying to get those guidelines out there in the world to be used, we're not really doing implementation science, because simply to distribute knowledge isn't to focus on the practice of that knowledge, as we've talked about at great length. So dissemination is important, but it isn't implementation science, and it isn't necessarily really focused on practice. And finally, effectiveness studies and program evaluation aren't implementation science either. Program evaluation, like QI, is typically focused on smaller scale, single program outcomes. It's usually less rigorous. It isn't meant to be generalizable. And it's often not really designed to capture, again, those context factors, the inner, the outer setting context factors or other dimensions of implementations. So the picture of what happened, the why and how, or the why not, is fairly narrow. So hopefully at this point, you're interested in implementation science. You have some initial tools that you can feel like you might start to work on adopting. And then you can use this kind of a checklist to start asking yourself if the projects that you're developing fit in to implementation science. Does my research clearly aim to answer a question pertaining to implementation? That's sort of the top question. We're really interested in studying the implementation side, how we're getting those practices into place to be used in clinical settings or community-based settings. Is there a clear description then of what is being implemented and therefore what is being studied? Does my research involve a predetermined implementation science strategy? If so, is it described and examined in its fullness, and what theories or methods might be used? So are you using an ERIC strategy or another kind of strategy? Does my research appropriately consider implementation outcome measures? Is there a correspondence with those Remien measures or similar sets of measures? Does my research appropriately consider context and other factors that influence implementation? Does my research appropriately consider changes over time and levels of complexity of the system? Because we know implementation can be really tough. We building in, trying to unpack why it can be so tough. Does my research consider the audience for my findings and how it can be used to advance practice? And that last point is to really underscore that we are engaging in implementation science to try to help narrow that 17-year gap that we talked about a while ago. So we want to really think about audience and utility, usefulness of our findings. That's a kind of conceit within the world of implementation science. We can use very complex and rigorous methods, even sort of so-called blue sky methods, but really for very grounded purposes. I hope that this introduction is kind of whetting your appetite for implementation science. And if you'd like to learn and dig in a little bit more, a helpful resource you might want to go to is the City University of New York Institute for Implementation Science and Population Health, ISPH Toolkit. There's a link here. You can also just Google it, ISPH CUNY Toolkit. And there you'll be able to read a little more about those different theories and frameworks of implementation science, and a menu of methods, scientific methods, that you might want to think about drawing upon as you're developing your projects. There's also some contact information if you'll follow up questions through that website. Finally, I'd like to thank several individuals and groups that provided helpful data and feedback to develop this webinar. And please feel free to contact me. I'm very happy to talk about implementation science and the projects that you're working on. Thanks very much.